Now to another big story today, that is the measles. We've been watching this outbreak spread across parts of Texas and New Mexico, and just this week, Indiana's state health department confirmed the first case of the year here in this state.
Now, it involves an unvaccinated child in Allen County who is stable and recovering, and health officials are working to figure out if there are additional cases.
They tell us because measles is so easily spread, one single case is considered an outbreak. The National Foundation for Infectious Diseases says about 1 in 5 unvaccinated people here in the U.S. who get measles will be hospitalized. 1 out of every 1,000 with measles will develop brain swelling, which could lead to brain damage. And 1 to 3 out of every 1,000 people with measles will die even with the best care. For adults, if you were born after 1957, chances are you're vaccinated with both doses. But if you think you're not or lost your vaccination records, you can take a test, and there's a booster available. If you were born before 1957, you probably had it as a child, which gives you natural immunity. You can always talk to your doctor about a booster if you're interested. And joining us now to talk more about this is infectious disease expert Tom Duszynski from IU's Richard Fairbanks School of Health. Thanks so much for being here again.
Thanks for the opportunity.
Yes, and this is highly contagious. Isn't the risk to the public, though, is it very low? How concerned should they be?
Well, every time there's a case, especially here in Indiana, that risk goes up, right? Because of it's so contagious. Like a single person could potentially infect 12 to 18 other people that are unprotected. Right, so it's very contagious.
And our neighboring states are also reporting cases. Ohio, about a dozen or so cases there. I know Kentucky also, and you were saying a number of other states as well.
Yeah, up to 22 other jurisdictions across the country are now seeing measles cases for more than, I think, 600 plus cases now across the country with 3 unfortunate deaths.
And so what are the symptoms, and then what can people do to protect themselves?
Yeah, so the symptoms usually start with a high fever, watery eyes, runny nose, maybe a cough, and then that telltale rash that usually starts up here about the hairline and then descends across the body. Typically, most people will tolerate that well. There is some supportive care. Up to 20% could be hospitalized, especially very young. And the best way to protect yourself is get vaccinated, right? We want 2 doses of the MMR vaccine before age 6.
And the last time you were here talking about the measles, we talked about herd immunity and how in Indiana, have we reached that herd immunity yet, or are we hovering around it?
We're hovering. We're not quite there. It depends county by county because every county has a little bit different vaccination rates. But when we look statewide, we are getting closer to that herd immunity. And that's the idea that we could vaccinate enough people for those that can't be vaccinated, whether they're immunocompromised or allergic to a component in the vaccine, we can protect them from getting the measles.
So we're close to that, and yet you hear the cases that are being reported in a growing number of states. How concerned are you? You've told me before, 1 case is cause for concern, but how much more concerned are you that we're seeing these cases pop up here and there in a number of other states?
Yeah, last year we had 284 cases total for the entire year, and now we're well over 600 already, right? So every time a new case comes up, I always worry about, well, how many more from that 1 case? Because we see this spread so easily among the unvaccinated communities. And because of that, then we're getting the complications of hospitalizations and unfortunately deaths that are associated with it. So anytime there's a case, we get concerned.
We only have a few seconds left. What would you tell those parents who are just concerned with vaccine safety?
Talk to your doctor, talk to your provider, a trusted health official. That's probably the best information that you're going to get around vaccines. Vaccines are safe and effective.
All right, Tom Duszynski, as always, thank you for being here. Really appreciate your help.
My pleasure. Thanks for the opportunity.
We'll be right back.